The introduction of the Attend Anywhere Virtual Oncology Clinic to Inverclyde Royal Hospital has been a fabulous initiative for lung cancer patients who live on the Isle of Bute and the Cowal Peninsula. Patients living in these areas are able to attend their pre-chemotherapy assessment remotely rather than taking a long road journey, including a ferry trip, to attend Inverclyde Royal Hospital. The oncologist links in from the West of Scotland Cancer Centre, and myself, the lung cancer nurse, links in from Inverclyde Royal Hospital to the patients who live in Bute at Rossi Victoria Hospital, and patients who live on the Cowal Peninsula to Cowal Community Hospital. Patients in these areas are supported by the Community Palliative Care CNS, who is able to take the patient's bloods and weights as part of their pre-assessment. Personally, I've found the quality of the service very good, not only in sound but in picture quality. For example, we had a patient who had a very severe cellulitis, and the quality was good enough to allow us to assess the progression of the cellulitis and then its response to treatment. We've had no concerns over patients feeling uncomfortable or awkward whenever they've participated. They seem to find it quite relaxing, and having the input of the palliative care nurses helps to reduce any anxiety they have with regards to the system. In terms of efficiency, it's been helpful in reducing the impact on the oncology clinic, which runs on a Thursday. So it's freed up space at that clinic, and when we see patients remotely, they actually are seen very quickly. And if there are any issues with the patient, if for instance if they are unwell, they can have a chest x-ray or an ECG at the community hospital, and the results can be reviewed by the oncologist remotely. If needed, the patients will come to the oncology clinic at Inverclyde the following day for a face-to-face consultation, or they can be admitted to the community hospital and transferred over to Inverclyde Royal. Involvement of the Community Palliative Care CNSs also provides continuity of care. Having the availability of the palliative care nurse allows for seamless transition of information and management plans for the patient, and it appears to me that that actually provides a much more holistic way now of supporting the patient. The introduction of the initiative has been so successful that we've now expanded it to also include patients who've had other oncological treatments and are returning for review appointments, and that again is cutting down time and the costs of patients travelling on a long road journey and ferry journey to Inverclyde from these remote areas.